Welcome to Talk 1260 KTRC. You're listening to Western Medicine. This is the Humanity Behind the Vanity. I'm Dr. Daniel Ronel here with my wife Betsy Ronel.
Howdy.
Talking about plastic surgery. And this week, what do you want to talk about?
Well, we have an inner beauty tip from Tess again,
Yes,
our reflexologist. She's
Mhm.
wonderful. And I think, here's something, I put out on my Facebook page, what are some questions about plastic surgery and or beauty that have gone unanswered for you?
Yeah.
So one of my friends from Sleepaway Camp wrote in and said, what about Botox? And she said, I feel embarrassed because we all know, we're all supposed to know about Botox. She said,
Right.
but I don't. She goes, I know about it, I know what it is, but I have a lot of unanswered questions about it. One of them was, is it safe to put a poison, botulinum toxin?
Botulinum
toxin,
Yeah,
in your body.
Get a lot of that in Santa Fe.
Yeah.
A poison is just a term. Aspirin can be a poison. If you take too much aspirin, you'll die. Digitalis, which comes from the plant foxglove, if you take too much of that, you'll die. So what does poison mean? I'm not sure. In this respect, the botulinum toxin, it just is called a toxin for pharmacologic reasons. It's so diluted in the medical application. It is so diluted that it doesn't really cause harm if it's done improperly or injected into the wrong place. Of course it can cause harm.
I went over that with her too. What are some of the harmful side effects it can have? We all know about the eye droop, which goes
Right.
away. Okay.
What it does is it weakens or paralyzes muscles. So if it paralyzes a muscle that you don't want it to paralyze, then that can cause a problem, such as the upper eyelid can cause a droop. If it's put in the lip, it can cause the...
That happened to me! Oh, that was funny. Okay.
And it can cause sort of a distorted smile.
Yeah. This is what I look like, you two.
Not that bad.
And I was slurping my soda. I was trying to drink out of a straw, and it was just drooling out of my mouth. Okay, sorry.
It can also be used to treat people who have a distortion in their mouth or in their face.
Interesting.
Right, because a lot of people have facial nerve palsy,
Right.
like a Bell's palsy.
Or they've had a
something.
stroke, perhaps. Does it
Exactly.
work on that?
Yes.
Yeah.
Well, what it does is if you inject the opposite side, it makes it more symmetrical. So
that are both the sides of their mouth weak and non-functioning, or? I mean that in all seriousness.
it's not done to that degree.
Oh, okay.
It's done for aesthetic
Oh, okay,
reasons. You
cosmetic
don't, right? It's
reasons.
not
Okay.
it's not a functional treatment.
Oh, I
in
see,
that-
yes.
In that aspect, because then if you paralyze both sides of the face, that doesn't help.
What do you have, right? Okay.
So,
I get it.
all right. So,
But wait, with that brings me
so
to another-
anyway, it's just
yeah.
not a poison.
I agree. You're preaching the choir here.
Right.
This could be depends on who likes me and who doesn't. I've been doing it since I was 25. I'm now 38. And there are people who don't like me who be like, well, that's what's wrong with her. And people who do like me, they can say, well, see, so it doesn't have any harmful effects.
Right.
It just depends how you look at me. But here's something, I just want to
Okay.
bring up one thing. You know how botulinum toxin was developed, as well as Radius and Latisse, and perhaps some other things? They were developed from medical issues.
Right.
So talk about that on,
Yeah,
on the Botox.
Botox was developed to treat strabismus, which is lazy eye. It was developed by oculoplastic surgeons to help kids and adults who couldn't see straight, and so by injecting specifically different eye muscles, they could cause the eyes to straighten. Then it was sort of expanded into the physiatry field, which is people... Physiatry field, which is
What's
people...
physiatry?
Physiatry is the study of rehabilitation. Like when you go to a physical therapist, that's rehab. If you take it up a notch to a medical level, that's a physiatrist, is an MD who does physical medicine and rehabilitation. And now
What would they
Botox,
use it for in that?
for muscle contractures, for example, if you've had a stroke, often your muscles are contracted, so it helps relax
What about
those.
burn victims?
Burn victims are contracted by their muscle, but also they have severe scar tissue, so that doesn't help, right?
Just curious.
But Botox has so many other applications besides just aesthetic applications. Migraines, if they're caused by muscle tension, I treat some patients who have migraines. Palm sweating, Underarm
sweating.
That's
yeah,
a very
that's a
big
big
one.
Yeah, that's really critical
Right,
for some
right.
people. Yeah.
Also, some people have bands in their neck. Not the turkey gobbler, so to speak, neck, but some
Right,
people
that
just have
this.
little bands in their neck that are caused by the edge of the platysma muscle. By the way, that's the muscle that the horse uses to shake off flies.
Oh.
Anyway, so you can put Botox in that.
Right.
There are people, I don't do this, who put Botox into the TMJ area to treat the grinding,
right,
the
the teeth
bruxism.
grinding.
Right, that's something. So there are a lot of different uses for Botox, and new ones are being discovered all the time.
Right. And no, you don't have to go and use it if you're a very natural person and if it's not for a medical issue and you're against using things like that. Otherwise, then don't use it.
Here's something else that people are reading about. There's a new botulinum, Dysport,
Right.
Dysport.
That's not a very attractive name. No offense, Botox.
Yeah, it's, anyway, Dysport, what's the scoop
Same
on Dysport?
company or different company?
Company, it's a competitor. People are happy because they think it might lower the Botox price. The jury is still out on whether Dysport is, sorry, I'm just very emotional about this. The jury is still out
Is
on
it? Okay.
on whether Botox is better. It's different. It diffuses more than Botox does, so there's the potential for more, collateral drooping.
Oh.
On the other hand, the diffusion perhaps makes you not need to use as much. The amount of volume that you have to inject, that's still up in the air. I like to really concentrate my Botox so they just get a little
Well, you're very
injection.
conservative, which is good because
Right.
you can always add more.
Right, I can't do
Right.
that with Dysport yet. But anyway, so we're still waiting to see whether all the hype is justified.
Is it used here in the United States?
Yeah, it's just starting to be distributed, and it is being used. And so I'm sort of waiting to see whether there's a large clinical experience before I start ordering it.
Yeah, that's smart. You don't want to use your patients as guinea pigs. There are many doctors who sort of do when they jump on the latest bandwagon. I think that's unsafe.
Yeah, I'd like to wait a little bit longer.
Good. All right. Welcome
All right.
to sports.
So you've been listening to Talk 1260 KTRC. This is Western Medicine, the Humanity Behind the Vanity. I'm Dr. Daniel Ronel, and we'll be right back.
With Tess DeGange and her inner beauty tip. Can't wait.